Hello. Today we are going to be discussing evidence-based practice plan to help promote and improve safety outcomes in regards to patients in rural communities. Today we are going to be discussing a patient by the name of Caitlin, who is a 2-year-old female who was recently admitted to a hospital in North Dakota for consistent bouts of pneumonia within a 6-month period. However, the doctor there, as well as the registered nurse, had worked with the respiratory therapist and ran some more tests, and this patient was diagnosed with um, cystic fibrosis. So, today we're going to be discussing how this patient can provide care and get the care that she needs while living in an area um, where care isn't remotely accessible. So like for instance, her hospital is an hour away. Although her pediatrician is nearby, he's not too familiar with um, this disease, as this is his first case of cystic fibrosis. Both of the parents are working and they will need additional assistance to be able to care for this patient. So, one of the models that I have researched is known as PCMH model, or Patient Care Medical Home Model. It was promoted and it's still very active in rural communities. It's discussed in this particular article by Berkeley France, who is a PhD, and he discusses integrated primary knowledge with medical knowledge in community based settings. PCMH was implemented and encouraged by the National Committee for Quality Assurance, focusing on what patients want, which is their needs, what patient wants, which is basically having their needs taken care of. PCMH is used to encourage primary cares to revamp how primary care physicians are used today. Further info could be acquired to determine if PCMH is really community based and whether the providers are more focused on their patients rather themselves or relying on technology to assist with patient care as well. Evidence-based practice was used to help develop this care plan. It is described as comprehensive patient-centered coordination, accessible and high-quality care, which is also noted by ruralhealthinfo.org. PCMH was also used to assist with technology and tools to promote health maintenance and assist with care communication. So basically, what they're saying that they want all of your to be able to get all of your care at one location. So imagine being able to go to your primary care physician and being able to Skype or telehealth your pulmonologist and to bring them in the care and being able to review your symptoms. Being able to have different techniques for chest physiotherapy, being able to focus in on your diet and offering the vitamins to help reduce infections, or, going over your fever and providing antibiotics prior to being admitted to the hospital, or, going over such as something as simple as discussing the color of your sputum or how much sputum, or, reviewing the symptoms before and hopefully treating the patient before they get to the hospital and before this becomes any worse. There are actually many programs that fall under the PCMH home model, such as community health teams that essentially work in partnership to connect you with your providers and your systems via care coordination. They also have a program known as the Lincoln ED Connection Program, and this helps chronically ill patients to identify the patient care medical homes and the community resources. So, for example, given the fact that these are two working parents, they might need to pull in additional systems. So, they could incorporate like home health nurses that come come and educate on the patient and see how the patient's doing, or a dietitian that can come in and see how the patient is eating, or talk to you via Skype on some of the diets to avoid, or some of the foods to incorporate into their diet for cystic fibrosis. It could just be as simple as vitamin drops, to promote, or seeing how they're eating. So it could be something as adding more protein to their diet or more nutrition to their diet, to prevent that rehospitalization rate. They also have state specific and home toolkits, as well as primary care webinars that also discuss the patient's or the child's well-being and their symptoms, and other parents that might be going through similar things, and that could provide insight to how they treat the symptoms and what works best for them. Positive benefits can include, but are not limited to, a multidisciplinary team that are working for the needs of the patients and to prevent further agitation and distress. Because, like I've mentioned, is that when the patient or the parents are relieved and they feel calm and not overwhelmed, then that's going to help reduce hospitalization, and the patient, they just feel more comfortable. They feel more comfortable that people are actually working for them, and that they know how to manage their disease process. PCMH is also useful because it involves team collaboration, involving the pulmonologist via technology such as Skype or telehealth. It can prevent rehospitalization rates when the doctor might have a better way of performing, like we have discussed, chest PT. They can also review the symptoms. They can prescribe antibiotics from home and also utilize oxygen if need be. They having easy access to the collaboration care team can involve, like I said, a medical social worker who can discuss community resources, such involving home care nurses, or home care, a dietitian, or a home care, even home cares have respiratory therapists these days. So incorporating all of that into their teaching can decrease the overwhelmness. It can also provide, extra support, and, like I said, assisting with community resources that we offer. Utilizing this practice shifts focus to team-based care with help and communication to better focus on patients' needs rather than, our needs or our wants. Implementing PCMH promotes many challenges, including shifting the whole dynamic culture to a team-based developing system, and then involving staff to be able to make that turnover without fatigue occurring. However, by implementing these strategies to overcome barriers such as developing a plan, um, setting aside time to be able to plan for this, encouraging meaningful relationships with all of your staff as well as your patients. These are all great opportunities to focus on a model that centers around patient cares and these needs. With the way that healthcare is shifting and the way that technology is kind of coming in and implementing this, um, I think that this is where our future is going, and to be able to have the technology and the Skype and the telehealth, and being able to have the home care, where is definitely going to reduce anxiety and agitation in this family in the future. Thank you for listening.